Hello, everyone. Good evening, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Hair loss, whether it's in hair loss in men or hair loss in women, it is a common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality is a human being cannot be overestimated. Hair is the first thing that people notice about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systematic factors. Hair can affect everyone, regardless of their country of origin. Thankfully, effective hair treatment can control and even reverse the hair loss process. We are here to know more about hair loss, its management, and more in details about hair care and its management. So let's connect today with our expert, Dr. Rohan Bhattacharjee, live from Durgapur to make us aware on hair loss and hair fall. Dr. Rohan Bhattacharjee is a well-renowned and an abroad certified dermatologist and dermatosurgeon. He pursued his MD at the prestigious Jawaharlal Institute of Postgraduate Medical Education and Research. After his MD, he earned his postdoctoral fellowship in Dermatosurgery and LASERs from JIPME. His area of expertise lie in hair transplant, laser hair removal, derma fillers, hydra facial, vitiligo surgeries, acne and acne scar treatment. He is known for his kind and humane behavior and holistic approach to patients' well-being. Dr. Rohan is the go-to dermatologist for anybody looking for an ultra-modern and research-backed approach to aesthetic skin and hair needs. So over to you, Doctor. First of all, welcome to this platform. And with that, our first question for you would be, why does hair loss occur?
Thank you so much, Priyanjali, and a very good evening to everybody watching this today. So coming to your question, Priyanjali, so why does hair fall occur? Now, we need to understand that hair fall is not an isolated event. Whenever hair fall is happening, there has to be something that is triggering it, right? So depending upon the age group, depending upon the gender, the reasons of the hair fall can be categorized into various things. So just to simplify it, I would categorize hair fall into probably nutritional deficiency related hair fall that occurs because of your genetic makeup, and hair fall that occurs due to your mechanical damage. Like whenever you apply excessive heat, straightening devices, blowers, hair dryers, everything can cause hair fall. These are the broad categories that everyone needs to know before embarking on the entire journey of hair fall treatment or hair fall management, right?
Right. Well, now that today that we are talking about one of the most major issues in our society, which every single person is suffering with. Our next question for you, doctor, would be, who is mostly affected by hair loss and is it preventable?
Yeah, so that's a wonderful question, Priyanjali. So if we look back at around probably 20 years back from now, and exactly now, so there is a stark difference in the prevalence of hair fall that used to happen previously and that's happening now. Even the age group and the gender has changed a lot. The age group being affected by hair fall has changed, and even the genders. So children, probably more than 10 years of age, adolescents, adults, and even people who are more than 50 plus age. So even everybody is affected by hair fall nowadays. But if you ask me regarding the highest numbers, I would say the age group between 20 to 40 is the one which is most affected. As always, females lead in this category again. The prevalence of hair fall is much more higher in females as compared to males, although males are not behind in this when it comes to male pattern baldness. And is it preventable? That's a wonderful question. See, thing is that 20 years back from now and right now, the kind of lifestyle that we live, the amount of stress, the kind of nutritional support that we have has changed a lot and evolved a lot. Although the science behind hair fall and the science behind hair growth has evolved a lot, we are getting to know that a lot of hair fall related issues are basically stemming from internal factors rather than from external factors. The high levels of pollution in the air, water, and also in the foods that we eat also triggers a lot of hair fall. Other than genetic causes of hair fall, I would say all the other causes of hair fall are definitely preventable to some extent, right?
Okay. Well, very diplomatically answered. And I believe this is important because सबके बॉडी का टाइप अलग होता है, सबके
बिल्कुल
बॉडी में डिफरेंट डिफरेंट चीजें हमें देखने को मिलते हैं. सो
बिल्कुल
आपके हिसाब से आपको देख के ही कोई बोल पाएगा कि क्यों हो रहा है हेयर लॉस या
बिल्कुल
प्रिवेंट
बिल्कुल
हो पाएगा कि नहीं. डॉक्टर विल
बिल्कुल
क्विकली मूव ऑन टू द नेक्स्ट क्वेश्चन. हमारा
राइट
अगला सवाल डॉक्टर आपसे है कि आई बिलीव जितने भी लोग आज हमें देख रहे हैं सभी ये पूछना
हाँ जी
चाहेंगे, पर डे नॉर्मल हेयर लॉस कितना होता है?
ओके सो अगर if I have to quantify it in numbers then I would say 100 to 300 hair in a single day is okay. But then again, according to different literature, different studies, सबके numbers अलग होते हैं. So what I would say is up to 500 hairs in a day is okay. But then again, who is counting, right?
Right, right,
Yeah. So
right.
a handful of hair falling in a day is absolutely okay. Nobody should be stressed with it. It's the natural process. उतना निकलना ही चाहिए, right? But if it's more than that, suppose many patients come to us with a big bag of hair or with a big envelope of hair in their hands, that is definitely pathological. That is more than normal for sure. So
Right.
a handful of hair in a day is normal.
डॉक्टर, हमने अक्सर लोगों को कहते हुए सुना कि बहुत बाल झड़ रहे हैं, बहुत बाल झड़ रहे हैं. पर मुझे पर्सनली ऐसा लगता है कि बाल झड़े तो प्रॉब्लम नहीं है, पर बाल आना भी चाहिए, ग्रोथ भी होना चाहिए. सो डॉक्टर, नॉर्मल कंडीशन में हमें ग्रोथ नॉर्मली कितना देखने को मिलता है? अगर 300 तक बाल झड़ना नॉर्मल है तो ग्रोथ उसके हिसाब से कितना हो सकता है एक एवरेज ह्यूमन बीइंग में?
या प्रॉब्लम क्या है ना, द प्रॉब्लम इज जो हेयर फॉल हो रही है ना, इट्स वेरी एपरेंट टू आवर आईज. हमें दिखता है वो आंखों में. बट जो
राइट.
हेयर ग्रोथ हो रही है ना, इट हैपेंस एट अ वेरी स्लो रेट. इट्स नॉट परसीवेबल विथ आवर नेकेड आईज. वो हमें दिखता नहीं है. हेयर ग्रोज वेरी स्लोली and the rate of hair growth is also different for different individuals. You might be having a faster hair growth as compared to me. It's different for everybody, okay?
राइट.
And different factors, if you have some other problems, genetic issues, everything causes the rate of hair growth to be different for different individuals. So the biggest problem that we face, that I face normally, is hair fall ho raha hai sir, but baal nahi nikal rahe. That is very,
राइट.
that's your question, right? So the
यस.
only thing that I would say in this kind of cases is, if it's not something that is that has a very deep rooted cause of hair fall, if there is no deep rooted cause of hair fall, then आपके जितने बाल झड़ रहे हैं, you are again regrowing the hair back from the follicle, because normally जो आपके बाल झड़ते हैं ना, वो follicle को साथ में लेकर नहीं निकलते हैं. Follicle is like the root. पेड़ के जो जड़ होते हैं ना, it's like the जड़. So
राइट.
the jad is not coming out, it's always there. The hair is going to regrow again, but at a very slow rate, right?
Okay, well, I think that was a very satisfactory answer. And now we'll quickly move on to our next question. Doctor, our next question for you is, do home remedies work?
Yeah. Now that's a wonderful question, because nowadays we come across a lot of onion shampoos, onion oils, this,
Right.
that, and a lot of things. This, that, your grandmother, grandfather must have told something gets passed on, amle ka oil and stuff, right? So if we look at scientific literature or scientific evidence, what does science say? Science has a very little evidence when it comes to all these kinds of home remedies, right? There is a different mechanism of different kinds of home remedies. It works to some extent in some people, but in most of the cases, it's just, kind of a placebo kind of thing. It just gives you a mental satisfaction that I'm doing some home remedy, DIY for myself. So probably it's working. The problem क्या होता है कि most of the people, when they start experiencing hair fall, they go for this DIY. And I do not despise any of them. It's totally okay to try out your grandmother's recipe. Definitely, why not? She has a lot of experience and that's why she's imparting it. Do it, but only to a certain extent. If you feel like still the hair fall is going on, it's always better to consult, some specialist and get to know what's happening inside, right? Because as I
Right.
told you, most of the causes of hair fall is not because of some external factors कि हम गलत तेल लगा रहे हैं या फिर गलत ऑयल लगा रहे हैं या फिर गलत शैम्पू इस्तेमाल कर रहे हैं. 95% of the cases are because of what's happening inside, right?
Okay, and now we will move on to our next question. Our next question for you is Doctor, नहाते वक्त काफी लोग बहुत ज्यादा हेयर लॉस विटनेस करते हैं या एक्सपीरियंस करते हैं. क्या हमें बाल कम धोना चाहिए, और अगर ऐसा है तो हफ्ते में कितना बार होना चाहिए?
राइट. अब बाल धोने की फ्रीक्वेंसी भी इट डिपेंड्स ऑन द पर्सन. इट्स आल्सो वेरी इंडिविजुअल, है ना. तो इफ समबडी हैज अ वेरी ऑयली स्कैल्प, अगर आपकी स्कैल्प काफी ऑयली है, डैंड्रफ की प्रॉब्लम बहुत ज्यादा है, you cannot stay even a single day without washing your head, you go out in the sun a lot, you're exposed to pollution a lot, then it's totally okay to wash your head 7 days in a week. There's no problem. You can even shampoo your head 7 days a week. कोई प्रॉब्लम नहीं है. You need to understand, शैम्पूइंग से आपके बाल नहीं झड़ रहे हैं. आपके जो बाल झड़ने थे because of the shampoo, it's all coming out together at the same time, and that's why you get panicked कि सारे बाल नहाने के साथ साथ झड़ जा रहे हैं. And that's why many people they think that shampooing की frequency कम कर देते हैं तो शायद probably हेयर फॉल नहीं हो. बट अगर आपकी स्कैल्प ज्यादा ऑयली नहीं है, आपको डैंड्रफ की इतनी प्रॉब्लम नहीं है, इट इज अ वेरी ड्राई स्कैल्प, इरिटेटेड स्कैल्प, then washing your head 2 to 3 times in a week is the optimum numbers that I would recommend. Again, it depends on the kind of place that you're staying in. If you're staying in a very temperate area, jahan pe the temperatures never go beyond 25 degrees Celsius, it's totally okay to wash your head 2 or 3 times in a week. It's absolutely okay. But if you're staying in a tropical area, jahan pe temperatures are always above 30, 32 degrees Celsius, you can go for head washing 7 days in a week. There's no problem.
Well, now that we know how to shower and how much to wash our hair, we will move on to our next question. Doctor, I think इसका जवाब आपने indirectly हमें दे दिया है अब तक. डाइट चेंज करने से हेयर लॉस क्या हम एक्सपीरियंस कर सकते हैं? If you have a change in our...
that's a beautiful question, because whenever you change your diet, suppose you go on a weight loss diet or a weight gain diet, any kind of change that happens to our body is going to cause hair fall. Be it diet, be it stress levels, be it water intake, be it the kind of place that you are staying in, be it the city that you stay in. Even change of profession, if tomorrow I become something else, I'll start experiencing hair fall. That is bound to happen, because hair fall as in whole is controlled by hormones circulating in our body, and the levels of these hormones ये सारे change होते हैं because of any kind of change in your body. So many people who go on a weight loss diet, they experience hair fall after 2 or 3 months of starting the diet. Many people who all of a sudden change their diet because of some or the other medical conditions also, even they experience hair fall. So, but normally this kind of hair fall again stops after some time, and वापस the hair growth restarts provided आपकी nutritional requirements are fulfilled in the optimum level, right?
Right. I believe ये लास्ट लाइन जो है, ये लाइन आई थिंक दैट वाज एनफ, क्योंकि काफी लोग अब आजकल हेल्थ कॉन्शियस भी बहुत लोग हैं. जितना हम फिक्र करते हैं हमारे स्किन के लिए, हमारे हेयर के लिए, उतना हम हेल्थ के लिए भी वी टेक केयर, वी डू स्टफ्स. तो आई थिंक जितने भी लोग अभी देख रहे होंगे जो थोड़ा सा फिजिक कॉन्शियस है, फिगर कॉन्शियस है, उनके लिए आई थिंक ये बहुत बड़ा झटका आ सकता है कि यार बाल झड़ सकते हैं उसके वजह से. बट एज अ डॉक्टर हैज ऑलरेडी मेंशन, ये चिंता की विषय नहीं है. हम चले जाएंगे हमारे अगले सवाल की ओर. डॉक्टर, हमारा अगला सवाल आपसे ये है दैट डज फ्रीक्वेंट कोम्बिंग or hair treatment like straightening and curling and etc., can it cause hair loss as well?
Yeah. So your question has two parts. First is combing, the other one is hair treatment.
Right.
Now combing is something जो आप घर पे खुद करते हो, right? So there are many proponents of this idea कि daily we should be combing our hair at least 100 times. 100 बार we should be running our comb through our hair. That's a totally false idea. No need of combing 100 times in a day. You can comb as many times in a day as you are comfortable. Excessive combing से hair fall नहीं होती है unless you are using a lot of pressure to comb your hair, right? This is the first part. Second part, coming to your treatments like straightening, using a dryer, blower, all kinds of heat devices. Yes, they cause hair fall. Immediately तब नहीं दिखती है. The hair fall starts around 2 or 3 months. जब भी आपने कोई straightening procedure करवाई किसी important event के लिए, everything goes happy, you have good pictures taken of yourself, but 2 से 3 महीने बाद you come running to the doctor saying, Doctor, I'm having severe hair fall. And that's because this heat devices that damage the protein and the cuticle, the outer layer of the hair. As a result of that, the hair fall starts for most of the people. And the bad part of this hair fall ये है कि ये जो hair fall है ना, it continues for quite some time. कई लोगों में 1 साल तक चल सकती है, right? So I always recommend that it's always better to avoid any kind of heat treatments to the hair. अगर आप करवा भी रहे हो, then आजकल there are many heat protectants available. You can first use them on your hair and then go for the heat treatments, right?
Right. डॉक्टर, हमने ये तो जान लिया कि स्ट्रेटनिंग या कोई भी केमिकल ट्रीटमेंट हो या हीट ट्रीटमेंट हो, उससे हमारा हेयर फॉल हो सकता है। हमने कोम्बिंग के बारे में भी जाना है, पर डॉक्टर हमें ये बताइए कि कोम जो नहीं करते हैं, जिनका आदत है कोम्बिंग नहीं करने का, उनके लिए आप क्या कहना चाहेंगे? क्या ये समवेयर हेयर लॉस के लिए भी वो दिशा पकड़ता है, नहीं कोम करना?
Right. देखिए, like you know, if you ask our grandmothers, then वो लोग बताएंगे कि you should regularly चंपी करनी चाहिए आपको सिर पे। ये जो चंपी का कॉन्सेप्ट है, ये उस चीज से आता है बेसिकली, जब भी आप स्कैल्प को मसाज करोगे ना, the blood flow to the scalp increases. As a result of that, hair follicles को ज्यादा blood मिल रही है, that they are getting more nutrition, they grow more, they become better, right? So combing has a similar effect. जब आप comb कर रहे हो, it's actually stimulating the blood vessels of your scalp, increases the blood flow to your scalp, and increases the nutrition. So it's always better to do some combing, even if you're not a big fan of combing, right?
ओके तो
Yeah.
लेजी लोगों के लिए है कि प्लीज अगर थोड़ा सा तकलीफ भी हो रहा है तो हाथों को थोड़ा सा तकलीफ दें, एंड मेक श्योर यू कोम्ब योर हेयर ऑन अ डेली
Right.
बेसिस। डॉक्टर, विल मूव ऑन टू आवर नेक्स्ट क्वेश्चन। हमारा अगला सवाल आई थिंक अगेन एक ऐसा सवाल है जिसके बारे में आपने हमें थोड़ा बहुत कहा है। डॉक्टर, हेयर फॉल का कारण डैंड्रफ क्या हो सकता है?
Yes, absolutely. Dandruff hair fall कर सकता है for most of the people. अगर आपकी स्कैल्प बहुत ज्यादा ऑयली है, आपको डैंड्रफ की बहुत ज्यादा प्रॉब्लम है, then डैंड्रफ के कारण excessive hair fall होना is pretty common for most of the people. But the good part is, इसमें अगर हमने डैंड्रफ को कंट्रोल कर लिया, then hair fall stops all of a sudden.
Okay.
And new hair also start growing. So it's always better कि आप डैंड्रफ का ट्रीटमेंट get it done, and if it's there, then get it done, and once it stops, once the dandruff is gone, then the hair fall also stops.
Great. Now we will quickly move on to our next question. Our next question for you is, Doctor, आजकल जितने भी लोग हमारे बीच है, आई थिंक घर से हो या बाहर से हो, हम काम की तरफ बहुत कीन हो गए हैं। वी आर सो मच ड्रिवन टुवर्ड्स आवर करियर। इनफैक्ट ट्रैवलिंग उसमें बहुत ज्यादा इंक्लूड हो रहा है। काम पे जाना है तो ट्रैवल करना है। आपने कहा है कि पॉल्यूशन एक रीजन हो सकता है हेयर फॉल का, तो पॉल्यूशन से थोड़ा बहुत को रिलेटेड हेलमेट, जितने भी लोग हमारे बाइकर्स हैं आजकल, मेल और फीमेल में हम डिफरेंशिएट नहीं कर सकते हैं बिकॉज बोथ द जेंडर दे राइड, तो जितने भी बाइकर्स हैं या बाइक लेके ट्रैवल करते हैं जो अक्सर हेलमेट पहनते हैं, क्या उसके वजह से भी हेयर फॉल हो सकता है?
So that's a beautiful question, because आपको एक चीज समझनी पड़ेगी कि जब आप हेलमेट पहन रहे हो and you're going out in the sun, it causes a lot of sweating on the scalp.
Right.
This sweat accumulates on the scalp, and you go to the workplace, you do your work, and you come back home. Now, अगर आप घर वापस आकर, if you're not washing your head, जो पसीना था, it's still accumulated on the scalp. Now, that sweat is not good for your hair follicle, right? So it's always recommended, if you're riding for long hours, if you feel like your scalp is sweating a lot, if it has accumulated sweat, then please come back, have a gentle wash of your head. That's the only thing that needs to be done, right? Many people come and ask me, should I stop wearing helmet? But that's not possible, right?
That's
so just this simple, just this simple change in lifestyle helps a lot.
Right. Well, ये simple change in lifestyle जो है अक्सर लोग मिस आउट कर देते हैं अपने लाइफ में, या नॉर्मली शायद बिजी शेड्यूल के वजह से टाइम नहीं दे सकते हैं। लोगों के पास आजकल बिल्कुल भी समय नहीं है, अपने आप के लिए सोचने के लिए समय नहीं है। इतना people are so much driven towards work that they have slowly and gradually, there are such crowd who are slowly and gradually started forgetting about themselves. तो उनके लिए ये है कि थोड़ा बहुत अपने आप को भी समय दे, and you will definitely see the change in your health. डॉक्टर, हमारा सवाल अभी भी जारी है। हमारा अगला सवाल आपसे ये है कि व्हाट आर द ट्रीटमेंट्स फॉर हेयर लॉस। अक्सर जितने भी लोग हैं जो बहुत ज्यादा हेयर लॉस से सफर कर रहे हैं, उनके लिए ये सवाल है, उनकी तरफ से ये सवाल है कि ट्रीटमेंट्स किस प्रकार के हो सकते हैं हेयर लॉस ट्रीटमेंट्स।
ओके, तो देखिए, जब भी किसी को हेयर फॉल की समस्या है, बहुत एक्सेसिव हेयर फॉल, देयर स्कैल्प बिकम्स विजिबल, या फिर पीपल हु स्टार्ट लूजिंग हेयर एट वेरी अर्ली एज, तो सबसे पहली चीज व्हिच शुड बी अंडरस्टूड इज दैट वी हैव टू अंडरस्टैंड द कॉज ऑफ हेयर फॉल, क्यों हो रहा है, राइट? स्ट्रेट अवे ट्रीटमेंट, वी शुड नॉट बी जंपिंग ऑन द ट्रीटमेंट, वी शुड फर्स्ट आइडेंटिफाई व्हाट इज द रीजन। मोस्ट ऑफ द पेशेंट्स ऑफ हेयर फॉल कुछ ना कुछ न्यूट्रिशनल डेफिशिएंसीज होती ही है, आइदर विटामिन डी और विटामिन बी 12 या फिर आयरन की कमी के चलते हेयर फॉल इज कॉमन इन इंडियन पॉपुलेशन, राइट? So if this kind of deficiencies are identified, then it's always better that we correct this kind of deficiencies, then even hair fall gets stopped, right? As we've already discussed, dandruff is one of the primary reasons of hair fall. So treating dandruff itself is a treatment for hair fall in many of the patients. Coming to genetic causes of hair fall, जो कि मेल पैटर्न बॉल्डनेस कहते हैं, फीमेल पैटर्न बॉल्डनेस कहते हैं, पापा को ऑलरेडी खानदानी गंजापन था, so you are also having that. So in those kinds of cases, we have different kinds of medications, we have different kinds of serums which help in treatment of this kind of conditions. But one thing which needs to be understand is hair fall की treatment needs patience. आपको धैर्य रखना पड़ेगा, because जो बाल है, they are like plants. आज आपने बीज बोया, they take some time to grow, they take some time to respond. If you do not have patience, you cannot get treatment for hair fall done. Other than that, अगर इन सब चीजों से भी काम नहीं कर रहा, we have different procedures जो आजकल हम लोग हेयर फॉल की ट्रीटमेंट के लिए करते हैं. Everybody must be aware, एक ना एक बार तो लाइफ में उन्होंने आज तक सुना ही होगा पीआरपी के बारे में, प्लेटलेट रिच प्लाज्मा ट्रीटमेंट के बारे में, मीसोथेरेपी के बारे में. So there are a lot of treatment options available now, but as I've already mentioned, and I still stress again, कि identify the cause of hair fall before jumping on the train for treatment of hair fall, right?
वेल, आज इस लाइव में हमें सिर्फ और सिर्फ सही दिशा दिखाया जा रहा है डॉक्टर द्वारा। डॉक्टर, हमारा अगला सवाल आपके लिए ये है, डू ओटीसी प्रोडक्ट्स लाइक एंटी हेयर फॉल शैम्पू एंड हेयर सीरम्स हेल्प इन कंट्रोलिंग हेयर फॉल?
Yeah. So as long as the cause of the hair fall is identified and it is being treated properly, right? Irrespective of what you are using, you will definitely see improvement. But then again, OTC products work to a certain extent, right? And if you still face, I never discourage anybody from using OTC product, right? Many people have faith over OTC products. It's absolutely okay. Please use it for a certain period of time, जब तक you feel like you're getting some improvement. But the moment you see कि the same condition आपकी persist होती जा रही है, then it's always better to visit a specialist and get the cause identified. Once the cause is identified, you get to know कि क्या lifestyle modification करनी पड़ेंगी या what needs to be done. You can work on that and everything becomes okay.
राइट। वेल, आज हमें ये चीज तो पता चल गया कि ऐसा कोई हार्ड एंड फास्ट रेमेडी नहीं है या रूल नहीं है जिसे हमें फॉलो करना है। हमारे शरीर के हिसाब से ही हम आइडेंटिफाई कर सकते हैं कि क्या लैक कर रहा है बॉडी में, एंड मे बी दैट इज द रीजन व्हाई यू आर लूजिंग योर हेयर। डॉक्टर, विल क्विकली मूव ऑन टू आवर नेक्स्ट क्वेश्चन। डॉक्टर, आपने पीआरपी के बारे में बोला, चलिए क्वेश्चन से थोड़ा सा हटके हम ये सवाल भी पूछ लेते हैं हमारे ऑडियंस के लिए। डॉक्टर, पीआरपी कितना ज्यादा पेनफुल होता है? बिकॉज आई हैव वॉच्ड फ्यू वीडियोस एंड आई हैव सीन द एंटायर प्रोसीडियर। बहुत देर का तो नहीं होता है, पर जितने भी देर का होता है, आई हैव सीन पीपल, इट्स एक्सट्रीमली पेनफुल। आप क्या कहना चाहेंगे इस बारे में?
So that's a very interesting question. So before I answer this question, I have to explain something to you called as pain threshold. तो पेन थ्रेशोल्ड का मतलब ये होता है कि आपकी पेन सहने की कैपेसिटी कितनी है. You must be having a higher pain threshold than me, right? For you, an ant bite, अगर आपको किसी चींटी ने आकर आज काटा, you might not feel anything at all. But for me, if an ant bites, I'll go crazy, right? So this needs to be understood first of all. मैं ये नहीं बोल रहा हूँ कि PRP is painless. PRP definitely is painful, but there are few things which we do before PRP, before we inject it. जैसे sometimes we apply a numbing cream, sometimes we give injections to cause anesthesia over the area. This kind of precautions and a properly relaxed mind. If you are very agitated, आप आते हो PRP करवाने के लिए, you have, you're fighting with your wife at home, you're fighting with your boss at the office, and then you barge into the clinic to get a PRP done, it's going to be painful for you. But if
Definitely
you
right.
come with a relaxed mindset and you know that definitely there will be some pain, but there is no gain without pain, right? So if you have that expectation, then obviously the pain will be less. But yeah, pain threshold varies for different individuals, and hence the pain amount of pain experience is very different and very individualistic for everybody.
और डॉक्टर, क्योंकि आपने पेन के बारे में तो हमें कह दिया, तो हमें ये भी बताइए कि क्या ये इफेक्टिव है? इज पीआरपी इफेक्टिव?
Yes, PRP is definitely effective. But as I've mentioned, the bottom line is unless your cause of hair fall is identified, there is no point in getting PRP done. And you need to know why it's happening before barging on to the treatment, right? PRP
Right.
definitely works for people with different kinds of hair fall, but we need to understand kisko chahiye, who needs it and who doesn't, right?
Right. Doctor, now we'll move on to our next question. हमारा अगला सवाल आपके लिए ये है, that is there any treatment for genetic baldness?
Yeah. Now that's a very important question, and it's a very it's a question mainly asked by the young adolescent age group who start losing their hair at very early stages. Somebody in the family must be having hair fall, right? So problem is in cases of genetic hair loss, there is a lot of hormonal imbalance that's happening in the body. There is something called as a DHT hormone जो आपकी body में घूमता है, and your hair follicle has got a receptor, DHT receptor. So binding of that hormone and the receptor and a lot of things, a lot of science happens behind it. I'm not going deep into it, but identifying genetic hair fall at an early stage in life and starting treatment at an early stage in life has a very good prognosis in keeping the hair on intact on the scalp. Right? Genetic hair fall has a very different way of progression. In some patients, काफी तेजी से बढ़ता है. In some patients, it progresses very slowly, right? But proper identification and early identification and treatment, and उसके साथ adherence to treatment. In some cases, the treatment may go on for years together, right? It can definitely be delayed. Genetic hair fall happens to some extent with each passing year, but we can slow down the rate of progression of genetic hair fall always, right?
Okay. Well, बहुत ही खूबसूरत तरीके से डॉक्टर ने हमें समझाया कि ट्रीटमेंट क्या हो सकता है जेनेटिक बॉल्नेस का. एंड नाउ वी विल मूव ऑन टू आवर नेक्स्ट क्वेश्चन. डॉक्टर, जितने भी पेशेंट है जो हेयर लॉस से सफर करते हैं और जो सर्जिकल ट्रीटमेंट लाइक ट्रांसप्लांट्स ऑप्ट करना चाहते हैं, उनके लिए आप क्या कहना चाहेंगे? उनको कब ये स्टेप अपनाना चाहिए, किस वक्त एग्जैक्टली?
Okay. So hair fall patients, many of the times they ask straight away and come for a hair transplant. So the first thing that we need to understand is we should always try to control the hair fall initially. अगर आपको बहुत excessive hair fall हो रही है, so first we need to control that acute stage of hair fall, जहाँ पे we can reduce the amount of hair that is coming out of your scalp, and then we can think of restoration. Hair transplant surgery is also known as a hair restoration surgery because we are restoring back what is lost. It's not a controlling surgery. We cannot control hair follicle, hair fall through it. So first we control the hair follicle and then we go for restoration. One thing which needs to be understood is hair transplant can be done at any age, but it's always ideal that you wait for at the age of at least 22 to 23 years of age. Irrespective of male or female, you can wait till the year of 22nd to 23rd. Once that year is, you have reached that level of maturity, then you can undergo hair transplantation. There is no hard and fast rule कि कौन करवा सकता है, कौन नहीं करवा सकता है. Almost anybody who does not have any other medical condition can easily get a hair transplantation done.
डॉक्टर, हमने हेयर लॉस के बारे में जाना, हमने ट्रांसप्लांटेशन के बारे में जाना. डॉक्टर, हमें आज आप ये भी बताइए कि आजकल जो बहुत अक्सर लोगों में देखने को मिल रहा है, इनफैक्ट मैं रिसेंटली एक बच्चे को भी देखी कि उसके भी बाल सफेद हो चुके हैं. हम जानते हैं कि धूप में बाल सफेद नहीं होते, ये हमें पता था, पर आजकल समय के साथ हमें एक्चुअली देखने को मिल रहा है कि धूप में बाल सफेद हो रहे हैं, क्योंकि जिसका उम्र नहीं हुआ है बाल सफेद होने का, उसका भी हो जा रहा है. इसका कारण क्या है, और अगर कोई भी रेमेडी हो इसका, तो वो क्या होगा?
Yeah. सो दिस इज वेरी ट्रू। आपने जो बोला कि जो प्रिवेलेंस ऑफ प्री मेच्योर ग्रेइंग ऑफ हेयर, समय से पहले बाल सफेद हो जाना, वो
Mhm.
बहुत ज्यादा रैम्पेंट हो गया अभी। एंड इवन द एज ग्रुप व्हिच इज अफेक्टेड बाय इट हैज आल्सो कम डाउन अ लॉट नाउ। यू कैन
Yes,
सी adolescents with white hair walking in the schools, है ना?
exactly, exactly.
Yeah. So as I've already mentioned, in the beginning of the talk, you take the circumstances now and take 10 years back, you will see stark differences in many things, starting from our stress levels to pollution to nutrition. A lot of things have changed, and all this, they show impact on the hair and the skin. I always believe that हमारी जो बाल and जो skin है ना, they are like a mirror to our inner body. Whatever is happening inside, आपकी skin और बाल पे वो दिखता है. Basically, most of the people who have premature graying या फिर समय से पहले बाल सफेद होने की प्रॉब्लम, उनकी जेनेटिक कॉजेज रहते हैं. Somebody in the family must have had this problem to some extent, and now it has got amplified in the patient that we're talking about. Secondly, excessive stress, too much sun exposure, and the high levels of pollution and poor diet is one of the triggering factors of this premature graying of hair. And once it starts, it does not want to stop. That's the biggest problem. एक बार शुरू हो जाती है, then it keeps on increasing, right? So these are the reasons why it's happening. And you must be already also interested in knowing how can we prevent it.
Yes,
So
right.
of course, yes, it is definitely preventable unless everybody in your family has this history. Agar if you do not have any genetic history, then it's absolutely preventable. Please start working out. Please eat a healthy diet which has good amount of vitamin D, calcium, iron, and vitamin B12. And please try to keep the stress levels in control by either doing meditation, pranayam, yoga, or whatever works for you, right? And even when you're going out in the sun, try to protect your hair, probably using a helmet or going out in the sun, or probably a cap or something, or just a simple umbrella works wonderfully for you, right?
Right. Well, डॉक्टर, आई थिंक आज हमने शुरुआत में थोड़ा सा वेट किया है डॉक्टर का. वेल, सम ग्रेट पर्सन सेड दैट अच्छे चीज में थोड़ा सा इंतजार करना पड़ता है. और आज हमारा लाइव ये इटसेल्फ इज स्पीकिंग, बिकॉज आई डोंट वांट द लाइफ टू एंड, बट आई थिंक इट्स टाइम. हमारे ऑडियंस के कुछ सवाल थे, but somehow we have already targeted those questions and we have already received those answers from you. So doctor, we would
Thank you.
wholeheartedly like to thank you for your precious time. We know that how hard you have tried to join this live and how badly we wanted you today in this live. We thank you, and we look forward to many more such sessions ahead. Thank you so much for the great and valuable session. And for our viewers, thank you so much. We appreciate your time and your patience. We look forward to such sessions with our viewers as well. Thank you so much for your participation, and have a great night. Thank you so much.
Thank you so much, Priyanjali. Thank you so much.